and if we look at what does a standard eye test mean? I mean, the core things that we test as a profession, as optometrists in general, is how clearly can you see? So that's a sight test on the chart. If you're not seeing the chart clearly, then we do a refraction, which is testing what the prescription is. We do as a profession, we do a sort of fairly basic test of how the two eyes are working together and how well the eyes move. We check eye health and pressures and so internal eye health and front of eye health, as well as pressure checking for things like glaucoma and those sorts of things. But as an optometrist who has a more holistic approach, is how is vision enabling you to have a great life and living up to your potential, we really want to then dive a lot more deeply into how well do the two eyes work together. That's also known as binocular vision or convergence or eye teaming. How well can you focus? The technical name for that is accommodation, but we just call it focusing skills. When we look at eye movements, we're not just looking to make sure that the muscles are intact. Often a standard test is really about, do the muscles work fully? Whereas we're looking at how well do they work? They're effectively a fine motor system. And so we might understand things like fine motor control in hands and fine motor control of speech. We want to understand the fine motor control that eyes actually are. And so what's the finesse in how you track and follow things? And those are really critical parts to everyday life. And eye teaming, focusing and tracking problems are a lot more common than eye disease, particularly in youth and young adults. And so we want to make sure that we're testing all those things. And for us, that's a standard. We do that comprehensively every single patient that we see. And that's a core difference, is we hang so much importance on those doing visual skills rather than just whether you can see clearly or not.
So we talked before we started about that famous scene from the movie Philadelphia where Denzel Washington says he's the lawyer, and he says to his client, explain this to me like I'm an 8-year-old. So yep. I just want to make sure that I understand this. Explain this to me like I'm an 8-year-old. So eye teaming, this is the ability to focus both eyes at an object correctly. Is that right?
Yeah. And if we think about looking along in space, we want to be able to point the eyes at the same point in space and allow the brain to easily create one image out of two inputs. So, and if they're not working well together, then at the extreme, you might get some problems with keeping the two images aligned, in which case you might get some double vision or some ghosting or sliding of images. A lot of people avoid that by putting lots of concentration in. So it could be an eye strain or a headache symptom. You may not get the double vision. But yes, one of the more obvious signs is that you're sort of, you're getting this kind of slip and double vision, something that we hope would normally happen automatically. But it's all about having both eyes pointing to the same point in space that you're interested in.
So somebody who maybe has I think it's strabismus, like some sort of, their eyes are not quite aligned as they should be. That would be something that you would pay attention to, or pay particular attention to in that case.
Yeah, so you've got various types of strabismus. So basically, we also call it, people do call them squints. It's a relatively old term. We call them eye turns because that's a very obvious way of stating it. You're trying to point your eyes here, but one eye wants to turn in or one eye wants to turn out. And certainly we want to rule out any sort of rare but serious problems that cause an eye turn. The vast majority of eye turns we see are from more developmental issues, that people develop an eye turn at an early age and it carries on through to adulthood.
Okay, so that's eye teaming. And you mentioned focusing. So I know it's probably an analogy that you don't like, but think of it like focusing a lens of a camera. That's really what we're talking about here, isn't it? Like the lens, the crystalline lens in the eye. Yeah.
So we've got this when we're young, sort of under 40, we have this lens that can actually change shape, and so we use a muscle to adjust the shape of the lens, which allows us to adjust how well we're keeping the world clear from distance through to near. And so that's where the word accommodation comes from. We call it sort of focusing. And you can have a number of different ways that focusing might not be working well. There can be an accuracy issue. You may not understand exactly where to position your focusing. And again, it either becomes blurry or you're having to constantly adjust it, which requires concentration. You might have issues readjusting your focus. So you're spending time doing near work, and then when you look up and away, it's blurred, and it takes some conscious time for your distance vision to become clear again. And some people might get it in the reverse direction, that it takes time to adjust back. So there's a not whether you can just simply get things clear, but how flexible is your visual system when you keep changing where you want to look. And then obviously, as we get into sort of aging process, that flexibility gets lost. It's not completely gone. It's still there. So we still need to manage focusing well into sort of late adulthood as well.
Yeah, I guess that's what I'm interested in, is that, like, for all of us as we get older, that accommodative function is going to diminish. So, but in your practice, if you're seeing those kinds of difficulties in younger people who shouldn't be experiencing presbyopia.
Not an age-related loss of function. They're usually having problems with function that's often lifestyle-based. For the vast majority of people, a lot of the focusing issues are just from the sheer amount of near work and device use we do nowadays. And so a lot of it is helping you manage keeping up with that level of near workload. And my sort of position that most problems actually do start in the focusing system. It's designed to be this dynamic thing where we're constantly changing where we're looking. And what do we do in modern life is we sit still and we look at two-dimensional screens. And so our focusing system fatigues. So that's another thing we can add in, is that you've got focusing accuracy, focusing flexibility, and simply do we just get some fatigue in the focusing system.
And tracking here, where, like, in practical terms, we're talking about, like, for example, the ability to track a line of text across a page. Is that right?
Yeah, and I'd like to talk to people about, there are two types of ways that we use the word tracking. The first being is you have a tracking problem, and that is you do not move your eyes very well. And so that can be something where you never learnt the fine motor skills very well as a child, and that carries on through. It gets a little better as we age, but there might sometimes be a few signs that we see there. You might end up with a tracking problem from a concussion or some other sort of brain injury or a virus, so that you can actually have issues with how smoothly you're able to use your eyes, or how well you do a saccade. So a saccade is a jumping eye movement, moving from one point to another, whereas those smooth eye movements we call pursuits. And then you can have tracking symptoms. And so yours is a great example of, losing place when you're on a screen, losing place when you're trying to read. So you lose track of where you are. Now, what we do is we then try and work out which part of your visual skill profile is leading to the tracking symptom. And it could be an eye teaming thing because you're fighting keeping the two eyes pointed on the page. And so it's this loss of binocular vision that then results in you losing track of where you are. It could be a focusing problem, same thing. You start concentrating so hard on keeping things single and clear that you lose track of where you are. And then finally, maybe you've got a problem in how you actually move your eyes.
So if you're into sports like cricket, baseball, something that involves a lot of, like, hand-eye coordination, then if you do have tracking problems, that's something that would really, be a big deal, I think.
Yeah, absolutely. And a lot of those sports anticipations there, but if you can't follow it up with a good eye movement, then you're going to be not performing at your best, that's for sure.